Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit system of post-acute healthcare services, including long-term care, short-term rehabilitation, independent living, assisted living, memory care programs, and hospice services available to our neighbors and families here in the Berkshires and beyond. I'm your host, Rachel Colasino, and my guests for today's show are Holly Harmon, Director of Therapeutic Activities from Hillcrest Commons Nursing and Rehabilitation Center here in Pittsfield, Jenny Sutherland, Activity Director at Mount Greylock Extended Care Facility, also here in Pittsfield, and Janice Paquette, Activity Director from Williamstown Commons Nursing and Rehabilitation Center. Welcome, ladies.
Thank you.
Thanks for having us.
Thanks for being here. So the focus of our show today is on a very special profession, which is activity professionals. And the reason why I wanted to do this is when I walk into our nursing homes, there is a very special type of person who has the ability to walk into a room and completely change the mood of the room to make people happy, to make people feel safe, and that's you. So I want to celebrate that today, and I want to talk about what you do. January is also National Activities Professionals Week, so again, we're going to dedicate our show to you, so thank you again for being here. I want to start with the basics. So what do activities professionals do?
Well, I think people sometimes think we just do bingo, birthday parties, and Bible study, but there's a lot that goes into it, some medical, some psychosocial, and some scientific portions of our jobs. And when I was starting off in this profession, Holly really kind of instilled that in me and made it more.
Thank you, Jen.
You're welcome.
I think that in addition to enhancing the quality of life for the people that we care for, activity professionals are aware that our central nervous systems are critically dependent upon the maintenance of sensory input. Without planned activity and people to reinforce that activity, we would retrogress to total dependency, dehumanization, and a complete lack of interest in life.
Really, we prevent boredom, loneliness, and isolation. And without that, residents in nursing homes would probably get care, food, and medicine, and there would be a whole lot of time where not much else happens. So we fill a lot of that time.
And you help with healing too. So Holly, how do you help short-term patients with their healing when they're only there for a short amount of time?
Yeah, I think that we probably are all trying to do the same thing, and that is to help people normalize their lives while they're with us. We know that one's leisure time can help in ways, for example, if you're trying to manage pain, that music and social activities, diversional activities can help to manage pain. And so we would do a full assessment of the individual to determine what types of therapeutic activities might help them in their healing process.
Great, and so that managing pain is obviously very important, especially for folks who are with you who are rehabilitating after a surgery, for example, who have a goal to get home.
Sure.
So Holly, I know Hillcrest has several different patient populations. It's our largest nursing home, and so there are a lot of different needs. So how do you manage those different needs?
Well, we have 9 separate and distinct programs of therapeutic activities that are designed to meet the needs of all of our different populations. We serve people who need medical long-term care, hospice care, weight wellness, behavioral health, Alzheimer's and related dementias. We also care for people who are ventilator dependent, and of course our post-acute rehabilitation program. The different types of programs that we would offer to each of those different populations encompass 8 different types of activities. They range from community-oriented to spiritual, educational, work type. We have specialized programs. Did I forget any? I'm sure I did. But we we try to help the individuals meet their interpersonal needs, intrapersonal needs, and their physical needs as well.
So between, for example, a traditional unit, sounds like there would be some specific programming, and then higher functioning residents probably have different types of programming in a different location.
Sure.
Yeah.
Yeah, let me run through the different types of programs that we do offer. For long-term care residents, we have several different programs. For lower functioning residents, and then another program for higher functioning residents. Your daily programs are for your lower functioning cognitively impaired people. And they go 7 days a week, 365 days a year, which all of our programs do. And then for your behavioral health units and specialized care unit for people with Alzheimer's and related dementias, those programs run until 8 o'clock every evening. And they would have programs such as music and exercise, social programs every day, routine, and routine is very important to their well-being, to their comfort level.
And Janice, how does Williamstown Commons look different from Hillcrest?
Well, Hillcrest Commons is a pretty large facility. Williamstown has about 152 beds, and we have what we call 3 units. So we have a short-term rehab unit, a long-term care unit, and an Alzheimer's dementia unit. And although we call them, we have these titles for them, there are crossovers in each of those areas. So there's residents that have some dementia that are on our long-term care, et cetera. But we run similar programs. I think we all run similar programs. We create an activity calendar, and we assess residents and have programs that are geared towards the different levels of our residents and the different abilities that they have. So we have less programming on our short-term rehab unit because they spend much of their time in physical therapy, occupational therapy, speech therapy. So we concentrate most of our programming on our Alzheimer's dementia unit or our long-term care unit.
And one of the very special parts of your programming is your pet therapy program, which we've talked about on the show before, but that's special to you. Can you talk about that a little bit?
Sure. We are extremely pet friendly, and we encourage family members to bring in visiting animals. And we have had dogs and cats come to visit. We've had ferrets come to visit and rabbits come to visit. But in-house, we have parakeets, and we just recently adopted 6 parakeets from the Berkshire Humane Society, so that was really exciting. And we have multiple fish tanks in the building. We have a pair of guinea pigs, and we have a foster cat program.
And how many cats have you adopted out through that program?
40.
That's great.
We
Awesome.
have just adopted our 40th cat out, and Williamstown is in the middle of renovations right now, which is affecting activities, meaning we're getting a brand new activity room. And so we will not be bringing in another foster cat until we have our new home.
Okay. And one of my favorite images from your pet therapy program is the therapeutic horse that's come into Williamstown Commons wearing sneakers, right?
Yes. Lots of fun. The residents have a really good time when the miniature horses come.
So Jenny, what about Mount Greylock? What are activities like there?
We're very similar to Williamstown Commons. We are, as Holly's facility is the biggest, we are the smallest. So we run programming all day through the evenings and on the weekends. We do a lot of one-to-ones. The staff is very good and flexible about that and taking time with the different residents who need specific one-to-one time and visits. We have a resident who's 102 and we have one that's 40 years old, so we have to run the gamut of age and appropriateness. So, but again, similar in all 3.
And one of my favorite memories of you is you had a cook-off several months ago. It was an hour, and you had several residents in the dining room watching 3 different people cook. And I was watching you, Jenny, and it could have been residents sitting quietly watching people for an hour, but it wasn't. You were entertaining them the entire time and making it funny and lively and interacting with everybody, and that is, I think, a really special talent that you all have, that you have the ability to do that.
Thanks.
So what type of training does one need to be in your profession, and what kind of ongoing education is there, Holly?
Yeah, the federal regulations require that activity programs in long-term care facilities be directed by qualified activity professionals, and they define that. One of the accrediting bodies is the National Certification Council for Activity Professionals, and they have different tracks for gaining certification as an activity assistant, an activity director, or an activity consultant. And all of the tracks require academic training, experiential, and continuing education, as well as now a national examination. And I think Janice and I are all certified as activity professionals. I think Janice has some special credentials there.
Well, I am also certified as a consultant, activity consultant, but the National Certification Council also has specialty areas that you can become certified in. One is memory care, one is education, and I believe one is assisted living, if you wanted to be specialized in programming for assisted living facilities.
Great. So what we're going to do, we're going to take a short break. We're going to hear a little bit more about Williamstown Commons, and we'll be right back.
In the heart of beautiful and culturally rich Williamstown, Massachusetts, near Williams College and the world-renowned Sterling and Francine Clark Art Institute, Williamstown Commons offers you the best of both worlds. It's a locally run facility staffed by dedicated healthcare professionals from the northern Berkshire area, and it's backed by the expertise and resources of Berkshire Healthcare, the largest nonprofit long-term care provider in Massachusetts. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Williamstown Commons is a proud recipient of the American Healthcare Association's National Quality Award. The Quality Awards recognize members' commitment to performance excellence by continuously demonstrating ever-improving value to residents and other customers. The Bronze, Silver, and Gold Awards recognize overall organizational effectiveness and capabilities and champion organizational and personal learning. At Williamstown Commons, we pride ourselves on our deep commitment to our community. We offer a broad range of nursing home services, including short-term rehabilitation, skilled nursing, long-term care, hospice, and respite care services. We also offer a fully dedicated Alzheimer's unit, providing individualized care, maintaining dignity and the highest quality of life for these residents. We proudly offer a home-like setting that allows our residents the comforts they expect while providing the care they need, including fine dining in our graciously appointed dining room, beautiful outdoor space, ample activities, and private family space. At the heart of it all is a focus on the body, mind, and spirit. Our rehab services include physical, occupational, and speech therapy. Our licensed therapy professionals help restore and maintain the body by focusing on helping our residents improve strength and mobility in order to participate in the activities they most enjoy. These services are provided up to 7 days a week when ordered by a physician. Williamstown Commons is more than a place to live. It's a place to enjoy each day to the fullest. Our activities program focuses on the mind and spirit of our residents by offering engaging leisure and recreational activities, arts and crafts, music, discussion groups, exercise sessions, religious services, and cultural community outings, and more. Each resident and patient at Williamstown Commons receives the highest quality care delivered by our dedicated staff members working as a team. From the nursing staff to our front office personnel, everyone is enthusiastic about the role he or she plays in the lives of the people who entrust us with their care. Our staff is committed to providing compassionate care, using teamwork as their guiding principle. We're dedicated to treating each person with dignity, recognizing their individual needs, goals, and preferences. We create a care plan for each person, focused on helping them achieve the highest level of independence and quality of life. At Williamstown Commons, we're perfecting the art of superior care. If you or a loved one needs short-term rehab, extra care after a hospital stay, or a nursing supervised full-time living arrangement, we invite you to tour and meet our staff. See firsthand how we enhance the lives of those we serve. To make arrangements or get more information, call 413-458-2111. We look forward to meeting you.
Welcome back. We are here with 3 directors of activities to talk about National Activities Professional Week, which happens in January. And we've been talking about your energy and your talent and the great work that you do. And so I want to find out from each of you how you found your calling and how you got into this. So Holly, can we start with you?
Sure. Upon returning from the Art Institute of Boston for the summer, my grandmother told me many years ago she had lined up a job for me at the local long-term care facility, and off I went to become a CNA. It was really a profound experience for me in that at first it was very difficult. I came home crying. I said I couldn't do it, but off I went again, and I quickly learned that that I could help other people, and that made me feel good. It made me feel something that I'd never felt before, and it got me out of myself at a very young age. I feel very fortunate to have found this profession in that I've learned so much. The education I've gained over the years has really enhanced my quality of life.
How about you, Janice?
Well, the activity profession is a second career for me. My first career was as a professional dancer, ballet and modern dance, and I did an extensive amount of dance teaching. And I was needing to end my career after foot surgery and was looking for something to do. A volunteer at Williamstown Commons, who I knew, told me I should apply at the Commons, and I said, I don't know anything about activities, and she said, go apply. And being an activity professional allows me to be creative, and that's what I really enjoy the most, to be creative.
And Jenny, I understand you got into your career by breaking a promise.
I did. I have a grandma story too. It's kind of a theme. I wish I had a dancing theme, but no. I made a promise to my grandmother that I'd never work in a nursing home. She was an 11 to 7 CNA for years and years and years. And when she passed away, I missed her stories, her life, and I started volunteering with a group of retired nuns. And I just wanted to spend time with them, do things, and so that's how I got into this career.
And so for our viewers who might be interested in getting into this type of career, what advice do you have? How does one get started?
Come fill out an application because, you know, we look for caring, creative, dedicated people that enjoy working with the elderly, and people that can work independently on their own, or working as a team is very, very important in activities. Being able to work with a resident individually as well as in a group setting, running a group program, extremely important.
I think that when I think about the Hillcrest Commons activities staff, the team, they're so phenomenal in what they do day after day. They're creative and caring and giving, and they are motivated as we are to help people. That is a prerequisite. I think that that's an important quality to have.
So you never look like you're in a bad mood. You never look like you're stressed out when you're at work, and I think that's amazing. So I want to find out, how do you maintain that? I mean, I'm sure that's not what you're feeling on the inside, but you, as activity directors, it never shows on your face. It always looks like you're there and you're happy and you're completely present. How do you maintain that?
I think that it's important for us to understand stress and stress management and the importance of stress management. To have those skills, you can't do this job unless you have developed those skills.
Generally, we have a good time. You know, we're doing things that are fun with people that we care about greatly, and our staff work extremely hard to meet the needs and the interests of our residents. So sometimes it's not all that hard. It's sometimes comes pretty easily to be up and.
How about you, Jenny?
Yeah. Well, when I'm driving to Mount Greylock, I always think I'm going to somebody's home. I'm going to 100 residents' home, and you know, if I'm sad or upset about something, I need to leave that at the door. I mean, we want to provide them with real life opportunities, but not our own baggage and stuff. And I also feel that we're kind of the heartbeat of the facility and the cheerleaders. So not only for the residents, but for their families and friends, and for other staff too. We kind of keep it going. So it's kind of an honor to do that.
Yeah.
What's the hardest part of your job, Holly?
Leaving it at home. We are in a caring profession, and the needs of the people that we serve are great, and we can never meet them all. And so having to learn how to turn that off when your day is over is important, so you can come back refreshed and do it all over again, because we know that our mood and our behavior affects those around us, and so we set the tone for the facility in a lot of cases.
Janice, what's the hardest part of your job?
I think saying goodbye as residents age and decline and we become close with them and we're developing relationships with the residents and their family members. I think the hardest part is knowing that life comes to an end, and their names pop up again in conversation and at other times. So I think that's what's really hard is, you know, we miss them.
Yeah.
We miss residents.
Something that really struck me when we were preparing for the show was you said people aren't forgotten. And I think that's important for people to know. What's the most rewarding part of your job, Jenny?
Well, it's definitely the people. I mean, to get to know these folks and their stories, and to bear witness to their lives, and to help them keep having lives. I think some people have the notion that people stop living when they come into a facility, that they're there just to get to the end of whatever that is. And that's not true. People are still having good times, sad times, their whole life is still happening, they're still alive.
What's the most rewarding part of your job, Janice?
I think seeing their smiles. I think seeing them have a good time and enjoy an activity, something as simple as just, you know, a hand massage to playing a competitive game. I think that's what's really rewarding, seeing their smiles and their enjoyment and pleasure out of whatever we're doing.
What do you think, Holly?
I think that Jenny and Janice have really done a good job at, in explaining that. The only thing I might add is to watch someone become comfortable and engaged, and the smile part is really big for me. It's to see that they're comfortable and happy.
Great. So, you know, we've talked a lot about what you do and what you have to do, and so I'm wondering, Jenny, do you have a way to kind of sum up everything together?
Well, this kind of goes back what we were just saying a few minutes ago. I remember working with this woman, and she had some dementia, and I asked her to tell me a story, and she did. And I never forget that story because she didn't have a remarkable life. She didn't do great things. She actually had no family left. So I feel that if I forget her story, she won't exist anymore. And again, we bear witness to people, and we care about people, and people feel comfortable when they're known and cared about. So I think it's an honor for all of us to do that. And I'm very happy to say, I think I can speak for all of us, that our staff feels the same way as well.
Yeah.
So I'm glad that we're the heartbeat of the facilities.
Yeah.
Nice work, ladies. Thank you for everything that you do on behalf of our residents and our staff, and we're lucky to have you. We really are.
Thank you, Rachel.
Thanks for being
Rachel.
here.
Thanks.
This has been InfoSource, a presentation of Berkshire Healthcare Systems.